Thank you all for coming today. My name is Misha Huck, and I'm a predoctoral research fellow at Northwestern University. Today, I want to talk a little bit about clinical outcomes in acne scarring trials. So why is this relevant to us? Acne scarring is one of the most common conditions that we treat with laser and energy-based devices. And many studies have been conducted that look at laser treatments for acne scarring, but the problem is that many of these studies assess different outcomes. So some of them may be looking at things like quality of life versus others looking at scar-related features. So there's quite a bit of variability when it comes to those things. So the way that we want to address this problem is that we encourage investigators to record the same outcomes. But how do we even figure out what these outcomes are? So essentially, our primary goal in this study was to identify which outcomes laser surgeons should consider measuring in trials of acne scarring. So essentially, we looked at a number of randomized clinical controlled trials to see which outcomes were the most commonly identified. We assessed different outcomes, and we didn't actually look at the outcome of the laser treatment itself. Rather, we looked at what outcome was being measured. So from our systematic review, we were able to identify 1,278 records, and after screening for duplicates and removing any articles that were not listed in our inclusion criteria, which is shown above, we were able to take two independent data extractors who removed all the outcomes from the full text of 50 reports. Of these 50 reports, over half of them used laser and energy-based devices as treatments. After extracting the data, we basically came up with a way to show which items were the most commonly assessed. So essentially, if we found outcomes in a large number of studies, we put them at the top of our list, and if we had outcomes that weren't in as many studies, we put those at the bottom. So the first table you see here is the effectiveness outcomes, and the most commonly assessed outcomes you can see here are the physician global assessment of scars, patient satisfaction, and quality of life. And to the right, you can see the number of studies out of 50 that these outcomes were assessed in. Then we have histopathological assessments, and in acne scarring trials, the top three that were assessed were general histopathological assessment, collagen content, and epidermal thickness. So we also took a look at adverse events because we don't want to just focus on what we're doing right, but we also want to focus on what to prevent to make sure that patients don't get more problems. So of adverse events, the most commonly assessed were erythema, edema, post-inflammatory hyperpigmentation, and hypopigmentation. And then lastly, we looked at scar-related outcomes. And of these, you can see there's quite a few different types. Specifically, the top three were scar-associated pain, roughness and texture, and number of scars. So what do we do now? Essentially, now that we have this long list of outcomes, our goal is to combine all these outcomes into something that we call a core outcome set. This is a standardized set of outcome measures that should be reported in all clinical trials of a specific condition, in this case, acne scarring. So the next steps for this research will essentially to combine a panel of international experts in acne scarring as well as patients with acne scarring and use them to kind of discuss the outcomes and see which ones are most critical for inclusion in the core outcome set. Then, upon completion of the core outcome set, we plan to disseminate the results and eventually create measurement tools that we can use to assess the outcomes that we have listed. We hope that the core outcome set will increase quality and comparability of treatments in acne scarring. That concludes my presentation.